Good morning, healthcare professionals, public health experts, human resources leaders, policymakers, and elected and appointed officials. Welcome to the inaugural Delaware Healthcare Workforce Summit. The planning committee for this summit is grateful for your attendance at this day-long event and for the support of the Delaware Division of Public Health's Office of Healthcare Provider Resources, the Governor's Office and its support through American Rescue Plan Act funding, the Delaware Healthcare Commission and its Healthcare Workforce Subcommittee, the University of Delaware's Biden School of Public Policy and Administration, and so many more. This funding and these collaborations allowed the Delaware Health Force to form in 2022, a public-private partnership between the state of Delaware and the Academy DPHA. Delaware Health Force is focused on researching and determining the status of Delaware's healthcare workforce and proposing solutions to increase access to quality, affordable healthcare in the first state. It is no secret that healthcare access is a significant component of the social determinants of health. Zip codes can sometimes predict health outcomes better than a person's genetic code. When we talk about healthcare access, we're referring to the availability, affordability, and quality of medical services. It's an essential right that impacts everything from chronic disease management to preventive care. Yet, it remains something that a significant portion of the population struggles with. And that's where primary care steps in. Primary care isn't just the front line of healthcare, it's the backbone. It is our first touch point with patients, providing comprehensive, continuous care essential for early detection, disease prevention, and management. Studies consistently show that robust primary care systems are associated with better health outcomes, lower mortality rates, and even reduced healthcare costs. Primary care is more than family physicians. Today, we include pediatricians, obstetricians, gynecologists, internal medicine pediatrics, internists, and geriatricians who treat patients across their lifespan. We count primary dentistry and behavioral health professionals as essential contributors to the primary care and healthcare workforce. And we recognize that nurse practitioners and physician assistants provide primary care, both independently and as a component of physician-led practice models. The work of primary care could not be done without the collaboration and support of a vast ecosystem of other healthcare professionals. Our primary care and broader healthcare workforce were already stretched thin before the COVID-19 pandemic, and matters further deteriorated during the pandemic and as we slowly recovered. We now face a shortage of primary care practitioners that is only growing in Delaware and in the nation. Why is this? Several factors play a role. First, the financial landscape. Primary care doctors often earn less than specialists, making the field less attractive to medical students already burdened with debt. Second, the burnout factor. Long hours, administrative burdens, and the emotional toll of patient care are driving many away from the profession. Additionally, the aging population means more people need care, while the number of new primary care doctors isn't keeping pace. There is a significant portion of the current healthcare workforce who are aging into retirement themselves, with fewer people available to make up the difference. Rural and underserved areas have been hit hard by the workforce shortage, creating a vicious cycle of poor health outcomes and even greater strain on the providers who remain. At the same time, those rural areas are rapidly becoming one of the most popular retirement destinations in the United States. So, what can we do to address this crisis? Solutions exist, but they require coordinated efforts. First, we need to make primary care more financially attractive. This could mean expansion of loan forgiveness programs, higher reimbursement rates, and incentives for serving in underserved areas. Second, we need to truly reduce administrative burdens. Streamlining paperwork and leveraging technology can free up more time for patient care. Third, we need to support all of the primary care workforce. This means addressing burnout through better work-life balance, mental health support, and fostering collaborative care environments. Finally, we need to continue to rethink and innovate our healthcare models. This can include the use of telehealth to extend the reach of primary care, especially into rural areas, integrating primary care with public health initiatives and community resources, and using multidisciplinary teams can create a more holistic approach to health. Primary care is the cornerstone of a healthy society, but it is under threat. By addressing financial incentives, reducing administrative burdens, supporting our whole healthcare workforce, and rethinking our healthcare models, we can begin to turn the tide. Let's work together to ensure that primary care remains a robust and vibrant part of our healthcare system. Because when primary care thrives, so do our patients. At this time, please welcome Tim Gibbs, Delaware Health Force Director, Principal Investigator, and Conference Facilitator to the podium.